This is my presentation on anxiety disorders in children. Anxiety is normal. It is the body's natural response to a stressful event and can create productive performance patterns. For example, if you feel anxious about a test, you will prepare for it by studying. An anxiety disorder occurs when the anxiety reaction becomes persistent and irrational. So my definition of irrational is in response to events that most would find to be non-stressful. There are 5 kinds of anxiety disorders: obsessive-compulsive disorder, post-traumatic stress disorder, social or specific phobias, panic disorder, and generalized anxiety disorder. The etiology of anxiety disorders can be attributed to abnormal brain circuitry. It can be diagnosed as young as 6 years. An example of abnormal brain circuitry is that people who are born without anxiety might see a stressful situation and they can determine whether or not that situation is stressful and whether or not it is worth their time. However, someone with anxiety may not be able to distinguish those two things and might treat every situation like a stressful situation. Anxiety can develop in teenagers due to brain changes that happen during puberty. Signs and symptoms of an anxiety disorder are irrational and persistent worry, the inability to self-soothe, restlessness, wearing out easily, an inability to concentrate, poor sleep, as well as muscle tension, think hunched shoulders, and spacing out. The functional implications of anxiety. I chose to discuss a functional implication of each anxiety disorder just to give you a broader idea of all of the implications of anxiety. One functional implication of OCD is that it can cause dominating habits that prevent timely completion of ADLs or IADLs. A functional implication of a phobia, especially a social one, is that it impairs social relationships that are vital to development. A functional implication of generalized anxiety is that it can keep children from engaging in educational pursuits for fear of failure. A functional implication of panic disorder is that it can keep people from going out in public due to embarrassment of panic attacks. Lastly, a functional implication of post-traumatic stress disorder is that it can also cause fear of leaving one's house due to the unpredictability of it and the fear that they may be triggered into an episode. The impact on development for children with anxiety disorders is that dominating habits that are often formed as a coping mechanism can prevent a child from positive performance patterns. Social anxiety can keep children from developing socially, culturally, and academically because, according to psychologists like Bandura and Vygotsky, learning is a social activity. Considerations for practitioners of occupational therapy include consulting caregivers and educators on strategies to help make the environment more welcoming to a child with an anxiety disorder. You may be the prime educator for family or teachers about anxiety. Also consider impoverished or dominating habits and replacing them with useful habits. The use of cognitive behavioral therapy and social emotional learning techniques to teach on an individual level, as well as teaching calm down strategies and promoting meaningful engagement in activities. Here are my references. Thank you and have a great day.